Understanding the anatomy. Swallowed food goes through the esophagus, that is, the tube through which food enters from mouth to stomach. Food then enters the stomach, where it is digested. Digested food from stomach enters small intestine, where most nutrients are digested further and absorbed into the body. Mucosa, inside layers, helps digesting and absorbing food. Middle layer of the intestine is the muscle that helps push food through. Serosa, outer layer, smooth and helps intestine from sticking together. Fibers and digested food finally reach the colon. In the colon, the rest of the nutrients get absorbed and stools are formed. Before excretion, stools are stored in the last part of the colon, that is, the sigmoid and the rectum. Ulcerative colitis. Ulcerative colitis is a disease that causes inflammation and sores, called ulcers, in the inner lining of the large intestine. Ulcers form in places where the inflammation has occurred in the lining of the colon. These ulcers bleed and produce pus. Ulcerative colitis causes diarrhea and blood in the stool. Ulcerative colitis can be quite painful and can lead to life-threatening complications. Inflammation due to ulcerative colitis usually occurs in the distal colon and the rectum, but it may affect the whole colon. If ulcerative colitis is not treated, it could cause serious medical conditions that may be life-threatening. Causes. The exact cause of ulcerative colitis is still not known, but following may be the possible causes. Autoimmune disease. Some experts suggest that ulcerative colitis is an autoimmune disease, wherein the immune system malfunctions, attacking some part of the body. Stress. Genetic factors. Who could develop ulcerative colitis? Ulcerative colitis affects men and women equally and appears to run in some families. It can occur in all races and all age groups. This disease is usually found in young people between the ages of 15 and 40 years, although children and older people can also develop it. Symptoms. People with ulcerative colitis may not have any symptoms for long periods of time. The most common symptoms of ulcerative colitis are heavy abdominal pain and cramps, diarrhea, weakness, fever, weight loss, loss of appetite, loss of body fluids and nutrients, loose motions, increased frequency of stools, blood and mucus in stools, straining efforts to pass stools, pain in rectum. Diagnosis. A thorough physical examination and a series of tests may be needed to diagnose ulcerative colitis. Blood tests can check for low blood count or anemia, which could indicate bleeding in the intestine. By testing a stool sample, the doctor can tell if there is bleeding or infection in the intestine. The doctor may need to do a colonoscopy, which involves inserting long, flexible, lighter tube known as an endoscope into the anus to see the inside of the large intestine. The endoscope is hooked to a computer and TV monitor. The doctor will find out whether there is any inflammation or bleeding. A barium enema X-ray of the colon may also be needed. Complication due to ulcerative colitis. Ulcerative colitis can affect nutrition, causing poor growth during childhood and adolescence. Liver, skin, eye, or joint, that is, arthritis problem, may also occur. Fortunately, there is much that can be done about all of these complications. In long-standing ulcerative colitis, the major concern is colon cancer. In these situations, it is particularly important to perform regular and thorough surveillance of the colon, even when there are no symptoms. Treatment options. The objective of ulcerative colitis treatment is to control inflammation, correct nutritional deficiencies, reduce abdominal pain, diarrhea, and rectal bleeding. Treatment may include diet, medications, surgery, or a combination of these. Diet. Seasoned, processed, or packed foods and packed milk should be avoided, as they may upset the intestine. Raw fruits and vegetables should be avoided to reduce injury to the inflamed lining of the large intestine. Avoid eating spicy food. This may cause more ulcers on the intestine. Follow your doctor's advice. Medication. Different types of medications may be used to treat ulcerative colitis. People with ulcerative colitis are usually treated with aminosalicylate medication first. This medication helps to control inflammation. This medication also helps if a person has a relapse. Hospitalization. In case of severe bleeding or diarrhea causing dehydration, the patient must be hospitalized. Surgery. In some case where there is massive bleeding, severe illness, rupture of the colon, or risk of cancer, then there may be a need of surgery. Life with ulcerative colitis. Patients who need to take medication for long periods of time are still able to hold jobs, raise families, and function successfully at home and in society. Exercises for ulcerative colitis patients. Exercises may help control the symptoms of ulcerative colitis. Regular exercises can increase your energy levels and help overcome the depression and stress that often occur with ulcerative colitis. Swimming, biking, jogging, playing tennis, football or soccer, basketball are all good options. However, many doctors suggest that yoga or aerobics is the best exercise. It helps in reducing some of the effects of inflammatory bowel disease, increase the digestion capacity, and also provides relaxation to the inflamed area in the colon. Please consult your doctor before starting any exercise. Do's and don'ts for ulcerative colitis patients. In case of ulcerative colitis, you should follow these instructions sincerely. Bed rest in case of severe symptoms. Light diet with no milk and milk products in the diet. Drink plenty of water and fluids to avoid dehydration. Avoid high intake of refined sugars, spicy foods, processed foods, deep-fried foods, and high-fiber foods. Stop alcohol. Take vitamins and mineral supplements as suggested by your doctor. Avoid taking multiple opinions from people around. Always approach your doctor for the right treatment advice. Managing stress during ulcerative colitis. Stress is one of the major concerns for those suffering with ulcerative colitis. People with ulcerative colitis would start thinking of themselves as outsiders or different from others because of their uncommon conditions. Chronic illness can make you feel like your life is out of control. These thoughts cause stress. Due to stress, the process of digestion may experience a change. It is necessary to overcome stress and lead a normal life with ulcerative colitis. There are various ways to overcome stress. Speak to your doctor about your stress. He or she would help you with the ways to overcome stress. Educate yourself about your medical disorder. Follow the medications as prescribed by your doctor regularly. Start yoga. Go for a long walk along a peaceful path. Start a hobby that relaxes you. Improve your ability to relax and handle stress in your life. Create constant happiness in your life. Avoid thinking about your past or present problems. Enhance your creativity, intelligence, and overall mental functioning. Clear yourself of any emotional roadblocks. Maintain a healthy sleeping pattern. After all, it is you who has to help yourself in keeping control over your stress by keeping your mind and thinking cool.